welcome everyone to this webinar about this really exciting opportunity that we're going to have in the state of Ohio. We have been working for some time on implementation or administration of a statewide youth survey. We have decided it's the Ohio Healthy Youth Environment Survey, and as we move forward with the slides, hopefully some of your questions, I know there have been some that have come in, will be answered, and if not, hopefully Dr. Raffel and I can answer them at the end of the PowerPoint. Okay, you want to move forward? Why do we need a statewide survey? Basically, we've heard from a lot of you in the field, from many communities, that we need community-level data in writing grants. Many of you have gone through the SPIF process, the Strategic Prevention Framework, done the assessment and planning and implementation and evaluation. All of those things, during that process, we really heard a lot. There's just not a lot of community-level data. So that's one of the reasons. This survey, a few years ago, we had a Strategic Prevention Framework Enhancement Grant, and we convened the Interagency Prevention Partnership, or the IPP for short. And those folks, that group, identified 10 priority projects, and this survey was one of those priorities to measure a collective return on investment for our communities and for the state. And we'll get into what that group, who's on that group in just a minute. It also will assist us with meeting our federal reporting requirements. You all know we have to work with SAMHSA's national outcome measures. We have CDC's YRBS, and also ONDCP's drug-free community core measures that we want to work with meeting as well. Okay. Thank you. Holly, do you want to take this slide since it was your work?
Sure, thank you. I appreciate that, Molly. Ohio University and the Pacific Institute for Research and Evaluation work with the IPP through the Strategic Prevention Framework State Prevention Enhancement Grant, the SPIF, beginning in 2011. And part of the objectives of the IPP was to look at getting community-level data, particularly around young people. So we had this looming question: who is surveying youth and young adults in Ohio? Originally, this project started with a substance abuse prevention lens because the funding did come from SAMHSA. So as we looked, we automatically went to our drug-free community coalitions. We know that they're required to survey every 2 years as a condition of their funding, so we know that our DFCs in Ohio were surveying. And then we set out on a process to conduct interviews with all the ADAMS and ADIS boards. We were able to talk to 33 of 50, and then we were able to fill in the gap with some internet searches. In our initial pass, we found evidence of surveying in 43 counties. And then the project started growing. As we started talking about it, we had people say, oh, there's survey going on here, there's survey going on there. We brought our Ohio Department of Health partners to the table, and they also had people doing some surveying of young people through the work they were doing as well. So those who we missed in round one came to us. We found in the end of our work there was 50 Ohio counties that had some type of survey effort that was going on within the county. It's important to note, though, that not all of the surveys were countywide, so they couldn't produce countywide data. So maybe they were at the coalition level, or maybe they were at the school level, but they didn't necessarily give county-level estimates of behaviors that young people were engaging in. It's also important to note that we found in some instances there were multiple surveys going on within counties utilizing different instruments. So one group was surveying with one instrument, another group was going on with another, and so it wasn't necessarily a coordinated instrument, so there was no real way to even calculate county-level estimates based upon multiple surveys that were going on by different entities within a county. The other place we looked at, because we know that young people are also in institutions of higher education. So as we know, there's a lot of institutions of higher education in Ohio, and so we did a phone survey of the 24 largest four-year colleges and universities and the 24 largest community colleges. We spoke to 27, or we found evidence of surveying in 27 of those institutions, and those were mostly our large four-year institutions. Throughout this project, though, we gathered all of the instruments from anyone who was willing to share. So anyone who was doing community surveys, as well as our institutions of higher education. We had 22 surveys. And some of the surveys were the same and they were used in multiple areas like the Pride survey or Communities That Care. So that's why we have 50 communities but less surveys. And so what we did was a content analysis of those surveys because we were interested, what were these people measuring? What indicators are they looking at? Are they looking at the CDC indicators? Are they looking at the Drug-Free Community Coalition's indicators? Are they looking at the SAMHSA national outcome measures? We also did a thematic analysis because we were curious as to what health content areas were people looking at. Were they looking at substance abuse? Within substance abuse, what substances were they surveying about? Were they looking at mental health? Were they looking at school connectedness? Were they looking at nutrition? So we really did that content and thematic analysis of all of those surveys to see what information we were already collecting about youth and young people in Ohio. We also thought, well, we've done a really good needs assessment and capacity assessment in Ohio, but we should probably learn from other states who have undergone a statewide survey effort. So we entered in the Beyond Ohio phase, trying to get that national perspective. So we queried our states in the nation who did statewide youth survey. We surveyed key prevention staff. 16 states responded. And then we were able to find, fill in some gaps of additional 8 states with an internet search. We focused on states who were able to provide county-level estimates of data because some states were in a similar situation as Ohio where you had a lot of surveying going on, but nothing that could provide those county-level estimates. So through that query with those people who were doing county-level estimate surveys, we had some lessons learned. We also put some process measures. We heard all about their processes, and we gathered their instruments as well. We did the same analysis, the content analysis, what indicators were they matching, as well as the thematic analysis, what topics were folks asking. The states that we talked to also recommended getting feedback from local groups. They said it's really important for you to get input from the field on surveying, just because, again, we want to be responsive to what the community's needs are if you're going to engage in this effort. Back in the summer, August of 2012, we had a large meeting, a stakeholder meeting, and many people came to that meeting, and we discussed a number of things, but the youth survey was also the topic at that meeting where we presented some similar information as we are today. We, of course, have had feedback from the IPP, and that's been ongoing since the beginning of this process. When the funding through House Bill 483 or the MBR came out that we were going to be able to move forward with some type of youth survey, the first thing we did was we had a very focused discussion with 2 of our sister states. So we went to Midwestern states. We looked at states who had more of a home rule. We looked at Iowa and Illinois, and we talked with them about their process and how they actually got a statewide survey, youth survey effort, how they undertook that, what their experience was, what their recommendations were, and how they moved forward. So the IPP really did their homework, and I think what we hope to show is that this process has been very deliberate with information gathering taking place from the field within our state, across our state, and also throughout our nation. So this has been a very purposeful and intentional process since the very beginning. So Molly, I'll hand it over to you now to talk more about the current status.
Thanks, Holly. As Holly talked about, we did get funds through the MBR to be able to go ahead and move forward with the youth survey. The interagency partnership, as you look on the slide, is made up of several state agencies. Department of Education and the Department of Health have been very instrumental, and we've collaborated on this whole process from the very beginning. Even back several years ago when we had our original prevention state incentive grant, some of the folks were around the table and we toyed around with the idea of having a survey. So we've been very excited about this. Some of the other partners are the Ohio Children's Trust Fund, the Ohio Suicide Prevention Foundation, the National Guard, different courts, the UMADOPS, and some higher ed folks. In the fall of 2014, we put out, Ohio MHA, put out an RFP to get some experts across the state that have worked with student youth surveys to have them work with us on marketing and recruitment, instrumentation, actually, building an instrument and training communities, as well as how we were going to do the survey online and develop the interface for the instrument and software for any kind of forms we might need to have. So these are the three entities that we have given money to work with, and so now they are a part of our Oh Yes team. Okay, thanks, Derek. The next slide shows some of the questions that we received prior to. We tried to address, and these were some of the really discussion points that the group went round about, I guess is a good way to say it. So I'm just going to go through these. Hopefully they answer some of your questions, but we do look forward to hearing other questions folks have, because that helps us to make sure that we're meeting everyone's needs. Is the survey mandatory? No. The survey is voluntary, and it will be available for all school districts in the state. What grades will be surveyed? We're requesting a census survey of 7th and 11th grades. That was a quite lengthy discussion of the group, but that's kind of what we settled on. So if you look at the next one, that there will be an opportunity to survey other grades, 7 through 12, and that will be at the district's discretion. The lowest grade that will be surveyed is 7th grade. Will the private and parochial schools be included? Yes. If they choose to be, yes, they will be included. To which county does a district belong? ODE has districts assigned to certain counties, and that's the list that we will be going with to determine where that data falls once it's available. The decision to participate in the survey will be at the superintendent level, but they can, once the superintendent meets with their, if I'm in Delaware City Schools and one of my schools does not want to participate, that building can opt out and it will not disqualify the whole district from participation. We will be using passive consent for the survey, and the lowest level that will be reported online is the county. So for public information, for everything that we can access, it will be county level data. If a building or superintendent wants that data, it can be drilled down to get them the information they need, but once that happens, then that data becomes public and is open to sunshine law and public information requests. So that is up to the buildings and the superintendents. We will, for the reporting and the data, the research staff here at Ohio MHA will develop a report on all the data that's collected. And actually one of the collaborative efforts that we have is that the Department of Health has a very large data warehouse, and they actually use network of care. And we are going to be utilizing the network of care and actually purchasing the behavioral health module to upload this data, the student survey data, as well as our state epidemiological work group data, which I think a lot of folks use and are familiar with across the state. Okay, next slide. Holly, did you have anything to add on that slide?
No, I did not. I think all of the questions that we discussed were covered. Thank you.
Okay. So the next slide shows the items and the domains that are going to be used or going to be available for on the survey. Can you move us forward, Derek? Oh, there we go. We are going to, there'll be demographics, alcohol, tobacco, and other drugs, mental health, which includes anxiety, depression, suicide, and protective factors, the ACE scale, which is the adverse childhood experiences to deal with trauma, gambling, physical health, including weight and height and sexual activity, family, peers, school safety, some miscellaneous items, and each local district, so the superintendents will have the opportunity to add local items, up to 10 items if they so choose. They will also be the ones who opt out of any questions they do not want to participate in. I know there's a lot of districts don't want those sex questions on there, and that will be up to the superintendent to decide which version of the survey they would like to implement in their communities. Okay, next slide. And how will you be able to access the data once the survey is done? We are anticipating that the data will be available in February of 2016. That's kind of a broad anticipation at this point because we're still working on timelines and things. But I talked about the data warehouse and the network of care, where this collaboration will provide communities with a one-stop shop for data access. The network of care is, like I said, some of you may be familiar with network of care, excuse me, because I know a lot of boards, there was a pilot that happened a few years ago, and folks were involved in utilizing network of care. But it's a very friendly, user-friendly, and comprehensive system that will enable folks to print reports, query different indicators, and be able to really get the information that they need around behavioral health data. And it will also include all of the physical health data in the system as well. The network of care will house the survey data, and the Department of Health and Ohio MHA staff will provide regional trainings to communities on how to utilize the network of care and the reporting and all the things that go along with that. I think that, Holly, did you have anything else to add?
No, I think it was covered. Thank you, Molly.
Okay. That's kind of the basics that we wanted to cover today, just to get it out there and give folks some just basic information. So at this time, Derek, I'd like to open it up for questions if folks have any.
Thank you, Molly. We do have a couple of questions that are coming in. If you do have a question, please ask your question into the questions field of your GoToWebinar navigation panel. And the first question is from Angela, and her question is, will these slides be emailed to us? And I can answer that. For everyone who registered, I can provide a copy of the slides as well as the link to the recording as soon as that's available. So we will have a message go out from me, D. Longmire, at drugfreeactionalliance.org. The second question is from Elaine, and her question is, DFC requires coalitions to survey 3 grades between 6 and 12. How will this support our DFC requirements and sample size needs?
Holly, do you want to field that one?
Sure. If you go back to the frequently asked questions slide, can you do that for us, please? Yes, thank you. We do know that the DFCs have that requirement, and so that's that third question, will other grades be surveyed? There will be the ability to survey other grades at the district's discretion, and so that would be something that would need to be worked out with the superintendent. And so we hope that superintendents are sitting on those drug-free community coalitions, and that the coalitions can work with the superintendents to make that happen at the school level.
And Holly, as a follow-up question to that, do you know if the DFC core data will be the same wording and collected the same as the survey assessment?
Yes, it is. Yes, it is. And actually, the hospital council is very astute to that, because many people who currently use them for their survey needs, and so all of those questions are on the survey.
Thank you. That question was from Dan, and the next question is from Amy. When you say 10 local items can be added, do you mean 10 questions, or what do local items mean?
Yes, 10 questions. And Matt, we put that in there just to follow up on that a little bit, because as Holly presented, when we talked to different communities, some communities were already administering a survey. So we wanted to be cognizant of that and make sure that if they had certain items that they had been surveying for 10 years and had some trend data, we didn't want them to lose out on that data that they've been collecting. So we wanted to enable that possibility for them to be able to add those questions to the survey so they could continue to collect their data.
And that was one thing that we did hear from our fellow states, our sister states that we talked to, and they strongly recommended that we have that option because it was very useful for them in their process as well.
Thank you, ladies. The next question is from Angela. Approximately how long does the survey take to complete?
I lost you.
I did too.
Oh, I'm sorry. Can you hear me now?
Are you there, Derek?
Can you hear me now?
I can hear you now.
Okay, excellent. The question from
Yes.
Angela was approximately how long does the survey take to complete?
The survey will take no longer than a class period, 40 to 50 minutes.
And we're getting ready to pilot it, and part of that pilot is to see how long that the survey will take.
And this question is from Elaine. How will school districts be recruited to participate in the survey?
That information will be coming forward. It will be through the superintendents. We're going to be reaching out to them. That's OSU, Ohio State University, is doing the marketing for the survey. We're also going to be trying to work with SPECA and some of our coalition folks to have prevention champions in the communities to assist with that process. And that information should be coming out in the next 2 to 3 weeks.
Thank you. And this question is from Angela, just to clarify the sunshine laws. If our DFC focuses on specific districts within our county and we request that data through the superintendent's office, does that mean their information will become public?
I believe so, but I will when Derek sends me those questions, I will confirm that. Unless, Holly, do you know that for a fact?
I think we were waiting for legal
Okay.
to give an opinion on that at our last meeting, is my memory.
Okay. We will confirm that, and these questions will all be posted. There will actually be a website that Ohio State is creating around the survey. So these questions and answers will be posted on that website when it's available.
And this question is from Elaine. And when do you anticipate the survey to be administered? We haven't released that information yet because we really want to get with the superintendents first. Thank you. And has there been consideration for ensuring 4th grade reading level to better allow all 7th graders to adequately participate in completing the survey? That question's from Karen.
I believe the hospital council, again, they have years and years of experience doing the survey, so I know they have, I'm sure they are doing that, yes. Holly, do you agree?
I think I would, and I think it's the lowest grade level appropriate is 7, and I don't, since the instrument hasn't been finalized, they haven't been able to do readability on it yet, and so that has not been calculated to my knowledge because we don't have an instrument complete yet.
And will it be available in other languages? That question is from Dan.
That is a good question, and I will put that on our list.
And once it starts, how often will the survey be implemented? That question is from Amy.
The survey, we're anticipating that we'll implement the survey or administer the survey every 4 years. That way it will not interfere with YRBS. So our partners at Health can still gather their data. Or, you know, the DFCs, it may fall in with some of theirs surveying and assist them with gathering some data without them having to have a huge expense for that.
And will the questions be asked about prevention efforts, messages received, education efforts in districts? What they're looking for is being able to compare communities with coalitions and those without and ask about any type of messaging. Do you know if that will be part of the core questions?
At this point, we're not really talking about the core questions until the instrument is finalized. And as soon as it's finalized, I'm sure it will be available for folks to take a look at, and we can address that at that time.
And when you're looking at communicating with the superintendent's offices, Would it also be possible to provide those communications to the ATOM boards and the Drug Free Community Coalition so everyone's operating on the same level? That question was from Elaine.
That would be why we're going to have the prevention champions in the communities. So our goal is to coordinate that process, yes.
And this question from Angela is, are we going to be able to get a copy of the survey instrument prior to it being administered?
Yes. It will be posted on the website.
And this question from Beth is, will the survey address bullying in healthy relationships?
Yes. There are many items that will be addressed on the survey. A lot of the items come directly from the communities that care, the YRBS, the core measures, the national outcome measures. At this time, we're really not getting into what each item is going to be on the survey. But looking at all the partners that are at the table and the experience and breadth of expertise of the folks, you can rest assured that everything will be covered.
And kind of questions in terms of frequency. I've got two questions, the question's similar, but it's both from Elaine and Angela. And for the every 4 years, that doesn't meet the community health assessment requirement or the DFC requirement because they're required to administer every 3 years. Can you speak to that?
Yes, the survey is not designed to replace the DFC measures or the nonprofit hospital needs assessment requirement. That's every 3 years on a rolling basis, kind of depending on what cycle your community hospital is on. What it's designed to do is collect that county level data every 4 years, and so some surveys or some communities may need to do additional surveying, and that, again, it's not supposed to meet everyone's needs, but it's supposed to meet some people's needs some of the time.
Thank you. And this question also from Elaine is, how will sample size be determined so counties that need to adhere to DFC requirements?
Holly, I'm going to let you address that one.
Again, that question is related to sampling sizes.
Can you read it one more time, Derek?
Sure. How will sample size be determined so community or counties that need to adhere to their DFC requirements will be included?
Sure. Right now, the recommendation is to do census. However, the sample size piece is still under consideration by the methodological team right now.
And looking at the sample size or grades, if they need to increase either of those, will there be local costs associated with that? So if they're looking to implement in additional grades or additional students per grade, would there be additional costs locally?
It's anticipated that the survey will all be done online, so there should not be any additional costs for communities.
Thank you. And if there's already a county-wide survey, will you work with the administrator of that survey to work with local contracts and address possible duplication? That question was from Amy.
That will be left up to individual communities to work with their schools and their superintendent to have any questions that, if they want any of those items on the survey, they need to work with the superintendent to get them on. The departments won't be working with communities directly.
Thank you. And this question is from Mary. How will we use the data with the Project Aware initiative? And I'm not familiar with Project Aware and how that's implemented. I don't know if you, Molly, or Holly are and are able to speak to that.
Actually, we will get with our partners at the Department of Education and have them address that question, and it will be included in the FAQs.
Thank you. And going back to the prevention champions, will they be included from local health departments as well?
Yes.
Okay. And from Elaine, her question is, could you clarify what you mean by the department not working directly with the communities?
We're not going to, the department, meaning the collaborative efforts, the Department of Health and the Department of Education and Ohio MHA, we will not be going out to, Amy's question, I believe, was will we work with communities and their contractors that are already doing surveys? We're not going to be in the middle of that discussion. That will be between the the folks in the community and the schools. We will just be working with the schools to implement the survey and then the communities to access the data.
Okay. Perfect. And that is all the questions that we have currently. If you do have questions that pop up post-call, feel free to send those questions to either Molly or Holly, and both of their contact informations are on your screen there. And again, just to recap, we will be providing a link to the recorded session as well as the copy of the PowerPoint slides for you to share with other community members who are unable to participate today. And I'll give you just a few moments, Holly and Molly, to have any final statements, or we can conclude.
I'm good. I appreciate everyone's time. Your questions were fabulous. And like Derek said, if you have any other questions, please let us know, because we're all moving into this working together, so we want to make sure we're meeting your needs.
And I would just echo that. Thanks to everyone out here who's participating and for your interest, because that really helps solidify that these efforts are needed and supported in Ohio's communities.
Okay, thanks again to both Molly and Holly, and to all of you for participating. Again, if you have questions, feel free to ask the appropriate people, and we will send out that information sometime next week for the PowerPoint presentation and the link to the recording. And we thank you so much for joining us this morning, and hope that you have a very safe and happy weekend, and look forward to connecting with you next week. Goodbye, everyone.